Dr. Lim, thank you so much for being with us today to share more information with us. Could you just give us a brief introduction about yourself?
I'm a consultant plastic surgeon. I still hold an academic position in the Yong Loo School of Medicine at the NUS, so I'm adjunct associate professor. And I also founding director of a Singapore-based biotechnology company called Cell Research Corporation.
Right, and I see that you are also a wonderful family man with 4 beautiful daughters.
I'm very blessed to have four girls, and they range in ages from 13 to 24.
Do you want to share a bit more about your daily practice?
Yes. In my daily work, I practice at the Mount Elizabeth Novena Hospital. I've got a private practice clinic here. We do a whole host of operations, plastic surgeons do.
Dr. Lim here will be the best person to share with mums as we talk about healing of wounds from a C-sec.
A caesarean scar is the incision placed in the lower abdomen to gain access to the baby should the womb need to be opened to deliver the baby. This can happen in a few situations, for example in emergencies, whether it could be an elective caesarean, where the patient or the doctor has elected to place the scar. This is usually a lower abdomen above the pubic hairline. Any scar placed will always remain. The whole objective for the caesarean scar is for things to be as faded as possible, to as they say, fade in time like tears in the rain. The most important thing being that tissue handling is precise. You keep the wound edges nicely opposed so that it will heal into a nice fine line. The healing process will depend on the closure. Usually a layered closure is employed by the obstetrician, where they will close each layer which they have opened in sequence, and whether they use external or internal sutures will all affect the healing time. But generally by 2 weeks, most surgeons would have exposed the wound to start scar care. And if there are any sutures outside, I think most surgeons will remove these by about 7 days. Well, certainly, I think sometimes because of various reasons, a wound infection being one of them, the scar may not heal as well, or the scar may get stuck to the deeper tissues. And in that situation, we do something called an excisional revision, where we take out the old scar and we loosen up all the tissue around it. We call that undermining before we close it again beautifully. Stem cells produce proteins which are encapsulated in little vesicles called exosomes. And these vesicle proteins have been shown to accelerate and promote wound healing. There have been quite a few studies employed to demonstrate accelerated wound healing when these exosomes are applied to wounds, but not specifically on caesarean scars. But certainly they will accelerate wound healing.